This is Zach. Like 28 million people in the United States, Zach is not eligible for Medicaid or Medicare and doesn't have insurance from an employer. Like the others in his situation, Zach is stressed. It's not that he doesn't have insurance, he does. He pays $300 a month for the silver plan he bought through the insurance exchanges, but he's still stressed about the copays he might be responsible for and his deductible, which is more than $3,500. Zach has $1,200 in the bank, for now. After his rent and car payment are due on the first of the month, he'll need to use all of his paycheck and some savings to pay his bills. It's the same every month. This means Zach decides not to go see a doctor, which only ends up increasing his future medical costs. And if something goes wrong and Zach really needs to use the healthcare system, he has no way to pay his deductible. That's stressful and confusing. Isn't insurance supposed to protect us rather than stress us out? If insurance doesn't really protect us, why is healthcare built around insurance? We thought about these questions and came up with a new one. What would a healthcare system for 28 million uninsured Americans look like if insurance didn't exist? First, we need to look at the cost of our current system for those 28 million Americans. When you add up insurance premiums, copays, deductibles, non-reimbursed expenses, and billing and administration expenses, you end up with a system that is far more expensive than the actual cost of healthcare. Now think about what would happen if we took insurance out of the equation altogether. Without insurance, the cost of healthcare would be equal to, well, the cost of healthcare. Without insurance, we could all buy the healthcare we want or need. Instead of giving our money to insurance companies and then fighting to get it back to cover the cost of care, wouldn't it cost less to just buy our healthcare directly? Of course it would. But how would we pay for it? It's called a single guarantor system. The government will already guarantee a loan for your house, your tuition, your small business, and plenty of other things. And with some of those loans, the government only requires individuals to pay back what they can afford. This is called means-tested repayment. Why couldn't our country guarantee loans for healthcare in exactly the same way? Think about Zach. Let's put that insurance payment back into his bank account. Now Zach has an extra $3,600 a year. He can put it in a tax-free health savings account, or save it, or knowing Zach, he'll probably just spend it. But if Zach ever needs healthcare, he can walk into any provider and pay directly, hopefully with the money he saved. If the total cost is more than he can afford, the provider knows that under a single guarantor system, it can charge Zach the same amount as what the biggest insurance companies would have negotiated and get paid within 30 days. So the provider just scans Zach's driver's license or state ID and checks a box for approval to determine his income through the IRS and his bank account levels for direct debits. At the end of the month, Zach gets a statement, just like a credit card bill, that tells him how much he owes that month based on his current income. It could be as low as $10 or higher, depending on the formula that will determine how much he owes. All of this data also goes back into the system, allowing us to search for fraud and find ways to improve healthcare for everyone.